Hi everyone, this is Dr. Alice, and I'm going to be walking you guys through what a Webster adjustment looks like. A Webster adjustment is a specific adjustment that we do for our pregnant patients. So, as you can see here, I'm starting with adjusting this woman's sacrum. The sacrum is a really important piece of the Webster adjustment because one of our body's really big brake pedals, the parasympathetic plexus, lives in that area. And so if that's out of whack or there's dysregulation with that, well, then that means we need to kickstart that brakes pedal and get that into gear, because that's the side of our nervous system that helps control, rest, digest, heal, restore, everything that we want going when we are pregnant, right? So you can see I'm doing my cervical check to confirm my cervical primary. With every adjustment, that is my goal. Where are the primary subluxations or the main area that needs to be adjusted on that person at that visit? I want to be as specific as I can be. So with her, I used an integrator, and with her thoracics, you can see I'm doing a manual adjustment for that upper thoracic to really kickstart in that area digestion and immune function. Now I'm getting into some soft tissue work. This is her piriformis muscle, which goes from our sacrum across our booty to our hip bones. And this is one of our main hip stabilizers. And so during pregnancy, as that baby is growing and center of gravity is shifting forward, those muscles have to work really hard to maintain hip stability. Now I'm on the sacrotuberous ligament. This ligament attaches from our sacrum to our sit bone. And because she had some sacral rotation that I started addressing with that adjustment, I'm also going to go in and release this ligament so her body can not only get into parasympathetic better, but she will then hold her adjustment better when we release that ligament. And then you can see from that, I also found a lumbar spinal bone to adjust, and I used my integrator there. Then on the front side for a Webster adjustment, there's 3 things we look at: pubic bone, round ligament, and hip flexors. So here I'm adjusting her pubic bone. I use my integrator through my thumb. Then I'm going to be going in and doing some work on her round ligament. Our round ligament in the front is one of our big main anchors that attaches our uterus to our pelvis, specifically the pubic bone in the front. So we want to release any tension in there because that can be pulling on the uterus, causing some pain for mom. Then I'm going to be releasing her hip flexor. So I'm on her left side here. This psoas muscle actually attaches to our lumbar spine, wraps around in front to our hip, all the way down to our thigh bone, and can really cause discomfort and pull that pelvis forward if there's a lot of tension there. So we get that released for mom. And there's our Webster adjustment.